is Kate. I'm an RN and I'll be doing an assessment of your eyes today.
Okay.
Before I begin, I just want to verify your name and your date of birth. And I've got that your name is John Doe, date of birth 4/26/1990. Is that correct?
That's right.
Alright. Clean and sanitize my hands and I have gloves on, but I just want to ask you a few questions real quick, okay?
Okay.
Do you wear glasses or contacts?
I wear contacts and glasses.
Okay. Do you have contacts in now?
I do.
Okay. And are you nearsighted or farsighted?
Nearsighted.
Okay. And do you have any history of recurrent eye infections, pain in your eyes, discharge, anything like that?
No, ma'am.
Okay. Well, I have my pen light, my ophthalmoscope, my opaque card, and my visual acuity charts. So let me just begin by inspecting your eyes.
Okay.
And I do note that your eyes are symmetrical. Okay. I do note your periorbital area is smooth. I don't see any lesions, lumps, no bruising. Do you have any pain when I palpate the area?
No.
Okay, and I don't palpate any crepitus. Alright, your eyebrows are symmetrical. They're evenly distributed. I don't feel any lesions. If you look down for me, your eyelids, your upper eyelids, no drooping or ptosis, no retraction. If you look up, okay, and your lower eyelids are upright with no intropin or ectropin, okay. Your eyeballs, as I assess those, you have no protrusion. They're not sunken in. They do align in the sockets bilaterally, okay. Next, I want to look at your bulbar conjunctiva.
Okay.
So I have my pen light. I'm just going to lift up your upper lid, okay?
Okay.
I want you to look down, okay? And as I'm looking at your bulbar conjunctiva, it's clear, smooth, and moist, okay? And I do see your lacrimal gland. It's not red with no edema. Okay, now I want you to look up for me. Now I'm visualizing your palpebral conjunctiva. It's clear with no foreign bodies and it's glossy. Okay, and let me just look at your right eye really quickly. Look down. Good, and same thing, your bulbar conjunctiva on your right eye is normal, your lacrimal glands visible and normal. And your palpebral conjunctiva is visible and normal as well. And I do note that your sclera in both of your eyes are white, moist, and glossy, bilateral. Okay? Alright. Next, I want to look at your corneas. So I have your corneas and your lenses. So I have my pen light, and I'm just going to shine it in both your eyes really quickly, okay? So look straight towards me. Okay, and I do see your cornea. It's moist, smooth, and transparent. Your lens is visible with no opacities. And that's in your left eye. Same thing in your right eye. Your cornea also is moist, smooth, and transparent, and your lenses are visible with no opacities, okay? Your pupils appear round, they're symmetrical bilateral and equal bilateral, okay? Your irises appear blue, they're the same color in both eyes, and they are round and flat. Alright, and I just want to palpate your nasolacrimal duct. I do visualize your puncta in both your eyes, and as I palpate your nasolacrimal duct, I see no drainage or discharge from your puncta on your left eye. And as I palpate it on your right, I see no discharge or drainage from your puncta on your right either. So that's normal. Alright, moving on. Next, I want to test your visual acuity. So you have your contact lenses in.
I do.
I have a Snellen chart, and I have an opaque card, so I want you to cover up one eye and read as far down as on the chart as you can, okay? And I'm going to stand 20 feet away.
Okay.
Alright, so we'll start covering up your right eye and we'll test your left eye, okay?
Okay.
Alright, read as far down as you can.
E, NH, NFD, ZX, TP, FTD, ZU, HTP, NFD.
So I would say that you're in these eyes far. Can you go any further than that?
No, ma'am.
Okay. So I would say that you're 20/20 on your left eye with corrective lens, and let's swap into your other eye.
Okay.
Alright.
ENHNFD ZXTP FTD ZU HTPNFD.
Okay, can you read any further with that eye?
No.
Alright, so you're 20/20 on your right eye as well with corrective lenses in. Alright, next I have a near acuity chart. I'm going to place it about 14 inches from your face, and I want you to do the same thing, okay? Cover up, we'll start with your left eye and read as far down as you can.
RICAEONLYECONEOMYTHINEEDTOGI.
Okay, is that as far as you can read? Alright, do your other eye. And I just want you to, what's the lowest line that you can read on this?
Okay.
Is it,
Oh, the lowest line I can
Mhm.
read is NEEDTOGI.
okay, so you're 14/14 bilaterally with your near acuity with your corrective lenses in. And that was testing your cranial nerve number 2 or your optic nerve, and I would say that it's intact. Next, we're going to do the corneal light reflex and the pupillary light reflex, and this tests your cranial nerve number 2, your optic nerve, and cranial nerve 3, your oculomotor nerve, okay?
Okay.
Alright. So I have my pen light, just look straight towards me, and I've got the lights dimmed, and I'm going to shine the light on the bridge of your nose, and as I do that, I do see that the light reflects in the same spot on both of your corneas bilateral, so that's normal, okay? Alright, next we're going to do pupillary light reflex. I'm going to test your direct and consensual pupillary light reflex, okay? So the lights are dim, and I'm going to shine the light, just look straight towards me and your left pupil, and now I see that it's 3 millimeters, your left pupil is, and as I shine the light in it, it constricts to about 2 millimeters along with your right eye. So you do have direct and consensual pupillary response or constriction. Now I'm going to do your right eye. Okay, and I do note that your right eye constricts to about 2 millimeters along with your left eye as well. So you have bilateral, direct, and consensual pupillary response. So those optic nerves are intact. All right, moving on, I'm going to do the 6 cardinal gazes. I'm going to stand about eye level with you. I got my fingers about 12 inches from your eye, and I'm going to move my other finger in 3 different directions on each side, okay? And I just want you to follow this finger, okay? Just with your eyes. Good. Now we're going to do it again. Good. And I do note that you have smooth and symmetrical simultaneous movement with both of your eyes as we do that. All right, next we're going to do the cover test. So I just want you to look straight at me. I want you to, I'm going to cover your one eye, and then I'll swap and cover your other eye, okay? All right, I'm going to cover your left eye. Okay. As I cover your left eye, I see no involuntary movements or nystagmus of your right eye. And as I remove the card, I see no nystagmus or involuntary movement of your left eye. Okay, same thing over here on your right eye. All right, as I cover that eye, no involuntary movement or nystagmus in your left eye. And as I remove the card, no involuntary movement or nystagmus in your right eye. Okay, so the 6 cardinal gazes and the cover test were both normal, and that test your cranial nerves 3, 4, and 6, which is your oculomotor, your trochlear, and your abducens. So all of those are intact, okay? All right. Next, we're going to do the confrontation test. This should test your peripheral vision. So I want you to hold this opaque card over your left eye, and I'm going to cover my right eye, and I want you to tell me when you can see my finger, okay?
Okay.
As I move it.
Yes.
Okay.
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 Okay. Now I want you to do the other eye. Over the other eye.
Okay. Okay. Okay.
Good. So your visual field degrees are normal. So that's intact. All right. Lastly, I want to look in your eyes. So I have my ophthalmoscope. I've got the light on, and I've got the diopter set at 0. So I'm going to first look in your left eye, so look straight at me. I'm going to hold the ophthalmoscope with my left hand and look at your eye with my left eye. I've got the ophthalmoscope about 15 inches from your eye, and I'm visualizing your red reflex, and then I'm going to advance the ophthalmoscope closer. Okay, and I do see that your vessels are visible with no crossing or defects. Your optic disc is visible. It's round, about 1.5 millimeters in diameter. It's yellow-orange. I do see your macula. It's transparent and about 1 disc diameter. So that's normal, okay? And then I would do the same thing with your right eye. So if I would hold it with my right hand and I would view it with my right eye, hold it 15 inches from your eye. Visualize the red reflex and then advance the scope. And I do visualize the same landmarks as in the left eye. Okay, so that's normal, all right? And that concludes my assessment of your eyes today. Do you have any questions?